Okay, so today we're diving into something I think we all think about, but maybe not as deeply as we should, heart health. And you've shared some fascinating excerpts from 10 Commandments of Heart Health Explained by Dr. Warrick Bishop and Dr. Karam Kostner. What surprised you most when you were going through this material?
You know, it's funny because this book, it really challenges your assumptions about who's at risk for heart disease. We always talk about, like, are you fit or not? And this book really gets into the nitty-gritty of why even marathon runners can end up needing open heart surgery.
Wow.
Yeah.
They tell the story of Dan, right? A marathon runner needing open heart surgery. And it's like, that is a wake-up call if you think, just because hit the gym a few times a week, you're off the hook. What was it about his case that doctors missed?
The plaque. Yeah, he had significant plaque buildup in his arteries, but it wasn't causing any noticeable symptoms, so he seemed like the picture of health. But underneath, things were definitely brewing.
So being fit doesn't automatically equal a clean bill of heart health.
Exactly. And that's why understanding your personal risk is so important.
And this is where modern cardiac imaging comes in, right? The book talks about how it's a game changer. It's not just about those basic risk calculators anymore.
Right. And, those calculators are helpful. But they can be a bit like trying to predict the weather with last year's almanac. Like, they give you a general idea, but they're not accounting for the individual nuances. And that's where cardiac imaging, specifically something called a coronary artery calcium score, steps in.
Coronary artery calcium score. That sounds a little intimidating. Is it a complicated procedure?
It's not at all. It's a simple scan that measures the amount of calcium in your heart's arteries. And basically, calcium is like the unwelcome house guest that moves into your arteries when there's plaque buildup.
Okay.
Which we know plaque is not our friend.
So the calcium score acts as a kind of early warning system for heart disease.
Precisely. Yeah, it's like having a sneak peek into your arteries before they become major blockages.
So what's considered a good score versus a bad score?
So a score of 0 is ideal, meaning there's no detectable calcium buildup. However, any score above 0 indicates some level of plaque. And the higher the score, the greater the risk of heart problems down the road.
And this plaque we keep talking about, the book, describes how dangerous even a tiny bit can be.
Yeah, it's a silent threat. And what's interesting is the book differentiates between flow-limiting plaque, which is the more serious blockage, and then non-flow-limiting plaque, which, while it's not as immediately dangerous, it can still rupture. And this rupture creates a rough surface that attracts clotting factors in your blood. And that can lead to a heart attack.
So even seemingly minor plaque can have life-threatening consequences. It makes understanding these scores even more crucial. It's like having a car serviced regularly to prevent a breakdown, but for your heart.
Yeah, you've hit the nail on the head.
Right.
Prevention is key when it comes to heart health.
Yeah.
Small changes implemented early and consistently can make a world of difference in the long run.
That's reassuring, especially since so much of this feels like we do have some control. And speaking of control, the book lays out 10 commandments for heart health, practical advice to protect our tickers. And the first one is pretty straightforward. Don't smoke. Why is kicking the habit so high on the list?
It's a curse on your cardiovascular system. Smoking. Think of the endothelium. The lining of your blood vessels has this delicate silk fabric. Smoking is like taking sandpaper to it, causing microscopic tears and inflammation.
Ouch. And all this time I thought it was just my lungs.
Unfortunately, no. It's much broader than that. These tiny injuries create the perfect breeding ground for plaque buildup. Smoking increases fatty deposits within the artery walls, thickening them, and making it harder for blood to flow through. And as we know, restricted blood flow is a recipe for disaster.
So quitting smoking, non-negotiable. Commandment number 1, for a reason. Now, on a slightly lighter note, what about exercise? Where does that fit in?
Commandment number 2, get moving. And they make a great point. Exercise shouldn't be a punishment for what you ate, but a celebration of what your body can do.
I love that. Takes the pressure off, right?
Yeah.
Make it about joy rather than obligation. But do they recommend, hitting the gym hardcore every day?
No, not at all. They highlight the power of simply walking. They call it a wonder drug for heart health. Just 30 minutes a day can significantly lower your risk of not only heart disease, but stroke and even type 2 diabetes.
See, that's doable and enjoyable. Now, you can't talk about heart health without talking about food. What does the book say about what we should be putting into our bodies?
Commandment number 3 is all about ditching processed foods and embracing whole natural options. They have this simple rule of thumb. If it comes in a package with a barcode and doesn't spoil when exposed to air, it's probably not doing your heart any favors.
That makes a lot of sense. So less takeout, more home-cooked meals. I'm sensing a theme here. Back to basics.
Exactly. Returning to the fundamentals of healthy eating. They specifically highlight the Mediterranean diet, rich in fruits, vegetables, whole grains. Healthy fats like olive oil, nuts, as a gold standard for heart health.
The Mediterranean diet. Always hear such good things. What is it about that combination of foods that's so magical?
It's more about what it limits. Processed foods, unhealthy fats, and added sugars. A study mentioned in the book found that incorporating this style of eating significantly reduces heart disease risk. And it's packed with antioxidants, which help protect your cells from damage. And fiber, which helps regulate cholesterol levels.
So it's really about making those sustainable swaps. Ditching the chips for nuts, choosing whole grains over refined ones.
Exactly. Small, gradual changes make a world of difference over time. And to make it easier, the book includes a handy swap this for that guide. With, practical examples.
I love that. Super helpful. It's fascinating how these small changes can have such a big impact, Speaking of small but mighty, the book dives into cholesterol, which always seems to be a hot topic. Help us break down the good, the bad, and the ugly when it comes to these fats in our blood.
Yeah, cholesterol is often misunderstood. It's not inherently bad. Our bodies actually need it to function. It's all about the type of cholesterol and how much is circulating in our bloodstream.
Right. We hear about good cholesterol and bad cholesterol. Can you remind us about the difference?
Absolutely. So remember those lipoproteins we talked about earlier? They act like tiny cargo ships, transporting cholesterol throughout the body. Low-density lipoprotein, or LDL, is what we call the bad cholesterol. So picture these LDL ships as a bit leaky and prone to dropping their cargo, which is cholesterol, along the artery walls.
Okay, so the LDL is like that messy transporter that leaves a trail of debris.
Exactly. And this debris builds up over time, forming those artery-clogging plaques we keep talking about.
Right.
On the other hand, high-density lipoprotein, or HDL, is the good cholesterol. Think of these HDL ships as the cleanup crew, scooping up excess cholesterol from the arteries and transporting it back to the liver for processing.
So it's like this constant battle between the messy LDL and the efficient HDL.
That's a great way to think about it. And having a healthy balance between the two is crucial for maintaining those clear, healthy arteries.
Makes sense. So how do we know where our cholesterol levels stand? The book mentions something called a lipid profile.
Yeah, a lipid profile is a simple blood test, and it provides a snapshot of your cholesterol health. It measures your total cholesterol, your LDL, HDL, and triglycerides, which are another type of fat found in your blood.
Triglycerides, those are the ones we want to keep low as well.
Exactly. High levels of triglycerides can also increase your risk of heart disease. So this lipid profile helps your doctor determine your overall risk, and then make recommendations based on those numbers.
It's amazing how much information a simple blood test can tell you. So let's say someone finds out their cholesterol levels are higher than they should be. Is it all about diet and exercise at that point?
Lifestyle changes are always the first line of defense. Switching to a heart-healthy diet, like the Mediterranean diet we discussed, getting regular exercise, and maintaining a healthy weight can significantly improve your cholesterol levels.
But what about cases where lifestyle changes just aren't enough? The book mentions a patient, John, who had extremely high cholesterol despite living a relatively healthy lifestyle.
Right, and John's case highlights the role genetics can play in our heart health. He had familial hypercholesterolemia, which is a genetic condition that causes the body to produce too much cholesterol. So for people like John, medication becomes a crucial part of managing their cholesterol levels and reducing their risk of heart disease.
So it's important to have that conversation with your doctor about family history, because it could really influence your treatment plan.
Absolutely.
Now, speaking of treatment,
the book talks about a class of drugs called statins, which are very effective at lowering LDL, that bad cholesterol. And they work by blocking a substance your liver needs to make cholesterol.
statins, I feel like those are always in the news. Are there side effects people should be aware of?
Yeah, as with any medication, there can be side effects. And it's really important to discuss these with your doctor. Some common side effects of statins include muscle aches, digestive issues, and liver enzyme abnormalities.
So it's all about weighing the risks and benefits, finding the right treatment plan for your individual situation. Now, speaking of medication, the book also dives into aspirin, which is a common over-the-counter drug that we often associate with headaches. Why is it included in a discussion about heart health?
Aspirin has a fascinating history. Beyond its pain-relieving properties, it plays a vital role in preventing heart attacks, particularly in individuals considered high risk. Remember our discussion about plaque rupture and blood clots?
Yes, a little unnerving.
Well, aspirin acts as a sort of blood thinner, making it harder for platelets to clump together and form clots. It's like throwing a wrench in the machinery of a potential heart attack.
So it's more of a preventative measure, especially for those who've had a previous heart event.
Exactly. However, it's not a free pass. Long-term aspirin use can increase the risk of bleeding. So again, it's crucial to discuss with your doctor whether it's appropriate for you.
Again, personalized medicine, making decisions based on your own unique risk factors. The book also touches on other heart medications like beta blockers and ACE inhibitors. What are those all about?
So these medications target another crucial aspect of heart health, blood pressure. Beta blockers work by slowing your heart rate and reducing the force of your heart's contractions, which in turn lowers your blood pressure.
So it's like calming the heart down a little bit.
Precisely.
Making it work less hard. ACE inhibitors, on the other hand, widen your blood vessels by blocking a hormone that narrows them. This widening allows blood to flow more easily, reducing that pressure on your artery walls.
Fascinating how different medications can address these different aspects of heart health. It's like this multi-pronged approach. Now I want to shift gears a bit and talk about a topic that's often overlooked but is equally important, the emotional and mental side of heart health. The book doesn't shy away from this.
Absolutely, and I think that's one of its greatest strengths. The book acknowledges the profound impact heart disease can have, not only on the body, but also on the mind and spirit. A heart event, or even just a diagnosis, can be incredibly overwhelming.
It's a lot to process, physically and emotionally. What kind of emotions do people typically experience? Fear and anxiety are very common. Fear of another event, fear of the unknown. There's often sadness and grief over the loss of their previous health status, the life they once knew. And then, understandably, some people experience anger. Anger at their bodies, anger at the situation.
It makes sense. You know, a heart event can really feel like a loss of control.
Exactly.
Which can be very unsettling.
And the book emphasizes that these emotional responses are completely normal and valid. And they stress the importance of acknowledging these feelings and seeking support.
Because ignoring them won't make them go away. It's about integrating this experience into your life in a healthy way. What kind of support do they suggest?
They emphasize the importance of connecting with your loved ones, seeking professional guidance from a therapist or counselor, and even joining support groups where you can connect with others who truly understand what you're going through.
It's so important to remember that you know. The heart is connected to the head. And really, the whole person. Now, you mentioned support groups. And the book dedicates a whole chapter to the importance of having a supportive medical team.
They do. They actually call it your heart health dream team, which I kind of love that.
I love that.
And it's not a one-size-fits-all situation. You need different players depending on your individual needs and circumstances.
So who are some of the key players on this dream team?
Well, your GP is kind of your quarterback, so to speak. They're your first point of contact. They assess your overall health, discuss any potential risk factors, and they can recommend any necessary tests or referrals.
Right, like a referral to a cardiologist?
Exactly.
Right.
Cardiologists are the heart specialists, providing those in-depth assessments and treatments. But your team might also include a registered dietitian to guide you on heart-healthy eating habits, a certified exercise physiologist to create a safe and effective exercise plan, or even a therapist to help you navigate those emotional and mental aspects of heart disease that we talked about.
So it's about assembling the right team for your unique journey. And speaking of journeys, the book shares some incredible patient stories about people really taking control of their heart health. Any that particularly resonated with you?
Yeah, there's one that comes to mind about a man named Tony. He was already pretty health conscious. He was taking cholesterol-lowering medication, undergoing regular treadmill stress tests. But something just felt off. He wanted a deeper understanding of his risk.
He wanted to look under the hood, so to speak.
Exactly.
Beyond those standard tests.
So he actually opted for a cardiac CT scan, specifically requesting that calcium score we discussed earlier.
Interesting.
And it was a game changer for him.
Wow.
The scan revealed significant calcium buildup in his arteries, indicating a much higher risk than his other tests suggested.
So the stress tests weren't telling the whole story.
Right. And this really underscores the importance of advocating for yourself, asking for those more advanced tests if you feel like they're necessary.
Be an active participant in your healthcare.
Exactly.
Not just a passive recipient. So what happened with Tony after he got his calcium score?
So armed with this new information, he worked with his doctor to adjust his medications, make some lifestyle changes. He doubled down on those healthy eating habits, incorporated more exercise into his routine. He really committed to those preventative measures.
It's amazing how empowering knowledge can be.
It is.
And, This story also highlights those 10 commandments for heart health that we talked about earlier. The book uses those commandments as a framework for taking action, providing those practical tips and strategies for incorporating them into everyday life.
Yeah, and they emphasize that it's never too late to start. Every small change, every step in the right direction can make a difference.
It's not about being perfect, it's about making progress, right?
Yeah, exactly.
Now, before we wrap up, I have to ask about something that really caught my attention. Renal denervation. It sounds like something out of a science fiction movie.
It does. It really does. It's actually a cutting-edge procedure for those who struggle with difficult-to-control high blood pressure. Remember we talked about the nerves around the renal arteries, those blood vessels that supply your kidneys, how they can sometimes go a bit haywire and contribute to hypertension?
Yeah, like those nerves get stuck on overdrive.
Exactly.
Yeah.
So renal denervation uses radiofrequency energy to disrupt those overactive nerve signals, essentially calming them down and allowing blood pressure to lower.
So it's like giving those nerves a timeout.
That's a great way to put it.
Mm-hmm.
And while it's not a cure-all, and research is still ongoing, it offers hope for those who haven't found success with those traditional medications or lifestyle changes alone.
It's incredible to see how science and technology are constantly kind of pushing the boundaries of what's possible in heart health.
It is. It truly is.
Yeah.
And I think this book does a really phenomenal job of highlighting those advancements, but also emphasizing that, the foundation of heart health really does lie in our daily choices.
Because ultimately, it is about taking ownership of our well-being. The book uses this really powerful analogy. If your car needed a service every 10,000 miles to prevent a breakdown, you do it right. Your heart deserves that same care and attention.
Such a great point. We invest so much time and energy into caring for our possessions. But often, our own bodies get pushed to the bottom of the to-do list. So I think this book is a really powerful reminder that prioritizing our heart health, it's an investment in a longer, healthier, more vibrant life.
And that's what makes this deep dive so impactful. It's not just about, absorbing information. It's about igniting action, empowering us to make those small but mighty changes that really do add up to a healthier heart, a healthier us. So as we wrap up, the question is, what small step will you take today to invest in your heart for the long haul?